I'm Monique Turner. I'm an associate professor in the Department of Prevention and Community Health, and I'm the assistant dean of MPH programs. I got my start in public health in a pretty untraditional manner. I was getting my PhD in communication, and particularly I was studying social influence and persuasion, the research that goes behind designing campaigns. Fast forward years later, and I found myself doing more and more research on what made public health messages work, and over time became to define myself as a health communication scholar. I think that the issue that's most fundamental to me that keeps me up at night are issues of violence and social justice. These are issues that are plaguing our communities. We need to make sure everybody has a voice in this, and we need to decide how we're going to help our communities that feel that nobody's there for them, right? And so this is our time to stand up and be heard and to help others. The best advice I've ever received wasn't verbal, it was through action, and it was from my dad. My dad's a working class guy, grew up on a farm in northern Michigan, and he's the kind of guy that got up every day and worked. He came home from his job and he worked some more. He worked around our yard, he fixed things around the house. If something needed to be done, he got it done. And I've really internalized this idea that if you want to get somewhere in life, that you need to get up and work. Get up in the morning and put your nose to the grindstone and decide what it is you want to accomplish and get it done. My favorite thing about living and working in DC is the diversity. I grew up in the country and I love rural living, but you don't see that kind of diversity in any fashion. And I love how the city thrives because it is a diverse place. My free time is spent in one of several ways. Number one, you can find me exercising. I teach a boot camp style fitness class 5 days a week, and then I have a running club on Saturdays, so pretty active in my fitness club. And the other things I do are typically with my children, right? I'm usually carting them around to ballet or piano lessons or to the pool or something, which is really fun watching them grow up. I research the cognitive and emotional mechanisms that underlie effective health communication. I think the most pressing problem that I'm trying to solve is how do we develop messages that are tailored to unique communities so that that message resonates with them and inspires them? Can we invigorate people's emotions in a way that makes them feel the difference that could happen in their lives if they changed what they ate, or changed their physical activity, or sought out mental health treatment, right? So what really excites me and makes me jump out of bed every morning is the idea that I could help crack the code on what makes emotional appeals work, and likewise when we shouldn't use certain kinds of emotions. I'm Monique Turner. I hope to see you on campus sometime soon.